Let's start with the clavicle bone. As we have already introduced the clavicle bone, let me show you what are the phases or in which parts the clavicle is basically divided. So as you see, this is the clavicle bone and this one is your right side. So this is the right clavicle bone and this is the left clavicle bone. The left clavicle, if you can see the left clavicle bone, there are some red and blue markings. The red markings are indicating to the origins of the different muscles that we will study. When you talk about if you can see the blue, some blue markings are there, they indicate the insertions of the muscles. The origin, the red marking and the blue insertion, these are basically the attachments. The first attachment of a muscle is called the origin, which is here indicated by the red one, while the second attachment is called the insertion, which is here it is indicated by the blue one. Well, we are talking about the bony landmarks. We will see the muscles and other attachments on another video. Okay, if you talk about the clavicle bone, it is basically divided into the three phases. The firstly, if I target, this is called the lateral end. This part is the lateral end, or also called the acromial end. Why this is called acromial end? Because it forms or it articulates with the acromion process of the scapula to form the acromioclavicular joint. I repeat, this is the whole clavicle. If you divide this is the right clavicle. If I show you thoroughly, here you can see. So if whole clavicle bone, this is the whole clavicle bone, you need to divide it into the three phases. The first part, this is called the lateral. This is the lateral aspect and this is the medial aspect. So this is the lateral aspect, the lateral 1/3. This end is also called the acromial end because it articulates with your acromion process of the scapula to form the acromioclavicular joint. When you talk about the medial one, this is the medial side. So lateral 1/3 and then you have a medial 2/3. The medial one articulates with the manubrium of the sterni to form the sternoclavicular joint. Let me show you on the skeletal. This is the lateral end which articulates with the acromion. This is the acromion process of, if I turn the skeletal, this is the acromion process of the scapula and it articulates with the acromial end to form the acromioclavicular joint. And then coming toward the medial aspect, this is the, here you can see, this hole is the chest bone. When you study the axial skeletal, this hole is the chest bone. The upper part is called the manubrium and this one is the body of the sternum, and this small part is the xiphoid process. When I talk, but we are not going on to the sternum bone, just come on the manubrium of the sterni. This manubrium has one landmark which is called the sternal notch that articulate with the clavicle. This articulate with the clavicle in order to form sternoclavicular joint. So this whole joint is the sternoclavicular joint. So we are not going into the joints basically. This articulation between the medial end of the clavicle, the sternal notch of the manubra and the first costal cartilage, they collectively form a sternoclavicular joint. Now if I talk about only the acromial lateral end, it has two surfaces. The one you can see from the above is the superior surface. If you talk about when you can see from the above is the superior surface. Here if I bring the anterior perspective, this is the superior surface, and the below you have an inferior surface. So let me demonstrate on it. If you talk about the lateral end of clavicle, it has one superior surface, it has one inferior surface. It means it has two surfaces. The one is the above and one is the below. If you talk about the borders, it has also two borders. The one which you can see from your front, the one which you can see from the front is the anterior border, which is, if you can see, this is the anterior border which is concave having some sort of the cavity, and other aspect the posterior border which is convex. So if I talk about, it has two surfaces, the superior one and the inferior one, right, and it has two borders, the anterior border and posterior border on the posterior side. So it has two surfaces and the two borders. If you see, the superior surface is some sort of the rough which is subcutaneous. When you talk about the inferior surface, it has some tubercles. Let me show you how. So this is the superior surface which is quite subcutaneous, and when you talk about the inferior surface, it has some ridges, tubercles. it has some tubercles. This tubercle, if you can see, if I mark with the pencil, this is conoid tubercle, and this what we can say, the rough lines, these are called the trapezoid lines or trapezoid tubercles. Tubercles means when there is some sort of the rigid or speed breaker type structure. So these are the conoid. Why they are called conoid? Because they give attachment to the conoid part of the coracoclavicular ligament. The coracoclavicular, the ligament between the, we know that the ligament connects the two structures with especially the bones. So coracoclavicular ligament, that it comes from the coracoid process toward the clavicle. So these are the two ligaments. It has two parts. Coracoclavicular ligament has basically two parts. The one is the conoid and one has the trapezoids. So conoid ligament gives attachment here, and they another aspect attached to the coracoid process. And these trapezoids line, they also attach the trapezoid part of the coracoclavicular ligament, and other part of this ligament would be on the coracoid process of the scapula. And when you talk about the border, these articulate with the acromion process of scapula and also gives attachment to the capsular ligaments, also gives attachment to the acromioclavicular ligaments in order to stabilize the acromioclavicular joint. Okay, so now if we talk about the shaft, the acromial end or the lateral end is almost clear. Now if you talk about the shaft of the what we can say, the mid shaft of the clavicle bone, this is the shaft of the clavicle bone. It has some rough surfaces and it has also the smooth surfaces. We will talk about it. When you talk about the lateral 1/3, this part is the lateral 1/3, and this whole part is the medial 2/3. Medial 2/3 is quite larger rather than the lateral one. And when you if you get confusion in if I as I told you about the conoid and tubercle, which one is the medial? If you talk about the conoid ligament is medial rather than the trapezoid. So if you come from the medial perspective, you will feel the conoid tubercle first, and then you will feel the trapezoid line. So conoid tubercle is round about 4 to 5 centimeter away from the lateral end of the clavicle, while the trapezoid ridges line, what we can say the rough lines, they are 3 centimeters away from the lateral end. Okay, so this was about the lateral end of the clavicle. Now we talk about the